Health news. Subscribe. Coronavirus outbreak, live updates. The rise of COVID-19 has left major landmarks like Times Square empty. Getty Images. The new coronavirus disease outbreak, initially identified in China, is continuing to grow more than 3 months after it was first detected in December. The disease is called COVID-19 and is caused by infection from the new coronavirus, SARS-CoV-2, which is one of multiple coronaviruses that can infect humans. Other examples include SARS, MERS, and even the common cold. COVID-19 cases so far globally, at least 190,000 people have contracted the virus in 155 countries and regions. More than 7,500 deaths have occurred. U.S. cases have now topped 5,600 with 94 deaths. Due to limited testing supplies, health experts believe the number of U.S. people with the disease is likely much higher. Officials ask young people to take COVID-19 seriously. Reported cases of COVID-19 in the United States have now surpassed 5,000. And officials worry many more cases are out there, but due to a lack of tests have not been reported. In a press conference today, federal officials asked all Americans and especially younger people to stay indoors and avoid gatherings of 10 or more people in an effort to slow down the spread of the virus. We're asking the young people help us with the mitigation strategy by staying out of the bars, staying out of the restaurant, really trying to distance yourself. Don't get the attitude, well, I'm young, I'm invulnerable, Dr. Anthony Fauci, director of the National Institute of Allergy and Infectious Diseases, said in a press briefing at the White House today. In some respects, you're certainly less vulnerable than I am. However, what you might inadvertently do, and I know you don't want to do that, you don't want to put your loved ones at risk, particularly the ones who are elderly, he said. In addition to the warnings to Americans to avoid groups, officials say people should still avoid bars and restaurants for at least 15 days to slow the spread of COVID-19. The president and his staff also discussed potential stimulus measures to ease the economic pain of the shutdown. The stimulus could include sending checks to nearly every American, a payroll tax, deferred tax payments, and other measures designed to protect the economy. Dollar Store starts to offer seniors only hour to protect older adults. The Dollar Store announced they'll offer seniors only hours at the start of the day in order to help protect at-risk older adults amid the COVID-19 outbreak. In a statement, the company said that the first hour the stores are open, only older adults would be allowed to enter. In keeping with our mission and our ongoing commitment to serve our communities, we are dedicating the first hour of each day to seniors. We appreciate our customers' understanding of our decision and request they visit our stores later in the morning to allow at-risk populations the ability to purchase the items they need at affordable prices, said Todd Vassos, Dollar General's CEO. New guidelines say avoid gatherings of 10 or more, avoid bars and restaurants. The federal government just issued new guidelines to fight the COVID-19 outbreak, advising people to avoid gatherings of more than 10 people for at least 15 days. The announcement came as the number of reported U.S. cases topped 4,000, just 5 days after it first reached 1,000. The cases of COVID-19 reported are likely vastly underreported due to lack of testing. Additionally, the federal government advised that certain businesses should close in states where the virus is spreading in the community, such as in Washington, New York, and California. The places that should be closed are those where people gather, like bars, gyms, and restaurants. The new guidelines come one day after the Centers for Disease Control and Prevention (CDC) warned Americans to avoid groups of 50 people or more for at least 2 months. San Francisco residents told to shelter in place for 3 weeks. Over 6 million residents in 6 counties in the Bay Area, including San Francisco County, are being told to shelter in place as COVID-19 cases continue to spread. Public health orders have been declared in multiple counties that prohibit movement except in special cases. The orders are some of the strictest to be imposed in the United States since the start of the COVID-19 outbreak in the country. Providers of essential needs like grocery stores, pharmacies, and gas stations will still be allowed to operate. Restaurants are also allowed to stay open but only to provide takeout options. Additionally, people will be allowed to go out for key essentials like groceries, to care for family members, or to go for a walk. 2 are physicians in critical condition with COVID-19. The COVID-19 outbreak in the United States is taking a toll on medical staff on the front lines, according to a new report. At least 2 physicians are in critical condition with COVID-19, according to the American College of Emergency Physicians (ACEP). One physician is in his 40s, based in Washington state, the state with the most cases and deaths in the United States. The other physician is a man in his 70s based in New Jersey. This virus is dangerous, and its impact is still unfolding. As emergency physicians, we answer the call to care for our most vulnerable, even at great personal risk, Dr. William Jackie, president of ACEP, said in a statement. Knowing that, I urge each of you to meticulously follow the recommended precautions to protect yourself. Perfume factories, distilleries start to make hand sanitizers as hand sanitizer producers are unable to keep up with demand. Other businesses are stepping in to help. This week, luxury conglomerate Moet Hennessy Louis Vuitton (LVMH) announced they would have all of their perfume factories start to produce hand sanitizer that will be distributed for free in France, with French health providers getting priority, according to WWD. Given the risk of shortage of hydroalcoholic gel in France, Bernard Arnault has instructed the LVMH perfumes and cosmetics business to prepare its production sites to manufacture substantial quantities of hydroalcoholic gel to be provided to public authorities, the company said. In the United States, at least one distillery in Portland is repurposing a byproduct of their production and using it to make hand sanitizer. Shine Distillery and Grill said that they're giving out free hand sanitizer to customers. Spain and France will start to implement nationwide lockdown as COVID-19 outbreak grows. With the center of the COVID-19 outbreak firmly in Europe, both Spain and France will join Italy in implementing nationwide lockdowns to contain the virus. According to the BBC, all shops in Spain would be closed except for those selling food or other basic necessities. In France, restaurants, cafes, bars, and other non-essential stores would be closed. Spain currently has over 11,000 cases with 509 deaths, while France reports over 6,600 cases with 148 deaths. On March 14, Trump announced that travelers from the United Kingdom and Ireland would be banned from traveling to the United States. The news comes days after Trump banned travelers from other parts of Europe. Exemptions may be made for Americans or permanent residents. Trump tests negative for virus. Trump's physician said the president has tested negative for COVID-19. The president was tested after he came into contact with a member of the Brazilian delegation later found to have the virus at an event in Mar-a-Lago. At least 2 other people at the same event contracted COVID-19. The president initially said he didn't believe he would need to be tested, but later relented. What life is like in quarantine across the country. People who have been exposed to the virus are entering quarantine. 2 families in New Rochelle, New York, where a cluster of COVID-19 cases was found, talk about their experience being stuck at home during a pandemic. National emergency declared. President Trump declared a national emergency in response to the ongoing outbreak of COVID-19. The declaration will allow the government to use $50 billion earmarked for disaster relief to combat the crisis. Additionally, the Federal Emergency Management Agency will be able to coordinate with local and state leaders to help better manage the outbreak. He emphasized that the emergency orders he's issuing will confer broad new authority to the Secretary of Health and Human Services (HHS), allowing him to immediately waive provisions of applicable laws and regulations to give doctors, hospitals, all hospitals, and healthcare providers maximum flexibility to respond to the virus and care for patients. He stated that the administration has been in discussions with pharmacies and retailers to make drive-through testing available in critical locations identified by public health professionals. The goal is for individuals to be able to drive up and be swabbed without having to leave your car. South Korea, widely praised for its testing measures, has been using drive-through sites to great effect, according to CNN, and New York State is one of the first states to introduce the practice so far. Trump announced the creation of a screening website, to be designed by Google, that will enable visitors to fill out a screening questionnaire, check symptoms and risk factors, and if found necessary, be informed where the nearest drive-through facility is located for them to receive the test. However, later in the day, reports surfaced that the website was not yet functional and that Google may not have been aware Trump would be announcing their involvement during the press conference. Biden, Sanders speak about Outbreak. Former Vice President Joe Biden, in his own speech on the pandemic, emphasized the universal nature of the risk COVID-19 presents. This disease could impact every nation and any person on the planet. We need a plan about how we're going to aggressively manage here at home, said Biden. He also forcefully disagreed that restricting travel is an effective method of containing the virus. The former vice president also derided the administration for a shortage of coronavirus testing kits, and insisted the White House should measure and report each day how many tests have been ordered, how many tests have been completed, and how many have tested positive. Additionally, presidential candidate Senator Bernie Sanders spoke March 12 and 13 about the impacts of the new coronavirus. On the 12th he took on the Trump administration for their response. We have an administration that is largely incompetent, and whose incompetence and recklessness have threatened the lives of many, many people in our country, he said. On March 13, Sanders pointed out that the outbreak shows the failures and vulnerabilities of our current healthcare system. It means that people who are sick today, people who woke up this morning with symptoms of the coronavirus are saying, "You know, I feel sick but I can't afford to go to a doctor," Sanders said. When somebody is not treated for the virus, somebody who is unable to afford to go to that doctor, that means that infection can spread to many others, putting us at risk. NBA suspends season, Broadway goes dark. The NBA has suspended the rest of the season after 2 players on the Utah Jazz tested positive for the virus. Players on 5 other teams the Jazz played in recent days will also need to be quarantined. New York Governor Andrew Cuomo announced a ban on gatherings of 500 people, which effectively means all shows on Broadway will be canceled. The president of the NCAA announced that the iconic March Madness basketball tournament will also be canceled. We talked to experts about why it's key to shut down these major events in order to stop the spread of the virus. WHO declares COVID-19 a worldwide pandemic. The WHO officially declared COVID-19 a worldwide pandemic on March 11. Dr. Tedros Ghebreyesus, the Director General of the WHO, pointed out that cases outside of China have increased 13-fold in just 2 weeks. Virus shedding is high early in illness. Study finds. A new study examined 9 people with the new coronavirus, SARS-CoV-2. The researchers wanted to understand virus shedding, when the virus leaves its host during illness, to determine how infectious the disease may be. Conducted by German researchers, though not yet peer-reviewed, the findings suggest that viral shedding occurred in high levels from the throat during early phases of illness for the patients studied. However, the rate of shedding dropped after the 5th day in all patients except for 2 experiencing signs of pneumonia. They continued to shed COVID-19 at high levels until the 10th or 11th day, according to researchers. The present study shows that COVID-19 can often present as a common cold-like illness. SARS-CoV-2 can actively replicate in the upper respiratory tract, and is shed for a prolonged time after symptoms end, including in stool, the study authors wrote. Scientists also found that people with COVID-19 may shed over 1,000 times more virus than emitted during peak shedding of the 2003 SARS infection. They say this could explain why COVID-19 has spread so rapidly. New York governor calls in National Guard for containment zone. Governor Andrew Cuomo has called in the National Guard to assist with the creation of a containment zone in the town of New Rochelle, New York, where the state's outbreak has been located. Large gatherings and schools will be barred in the town, which is north of New York City. The National Guard will be used to help with cleaning public spaces and ensuring everyone has access to food. COVID-19 has 5-day incubation period. CDC warns at-risk groups to prepare. Researchers at Johns Hopkins Bloomberg School of Public Health analyzed publicly available data to find COVID-19 has roughly a 5-day incubation period from exposure to onset of symptoms. The analysis trusted source also suggests that about 98% of people who develop symptoms will do so within 11.5 days of exposure. Researchers said this average time from exposure to onset of symptoms suggests that the CDC's 14-day quarantine period for people who were likely exposed to the virus is reasonable. Based on our analysis of publicly available data, the current recommendation of 14 days for active monitoring or quarantine is reasonable, although with that period some cases would be missed over the long term, said senior study author Justin Lessler, Ph.D., associate professor at Johns Hopkins Bloomberg School of Public Health, in a statement. Another recent study from Sun Yat-sen University in China has discovered that SARS-CoV-2 may have an ideal temperature at which it spreads most easily. Researchers analyzed the cumulative number of all confirmed cases in all affected cities and regions from January 20 to February 4, 2020. Their findings suggest it spreads most easily at about 48 degrees Fahrenheit (8.89 degrees Celsius). The study found that, to a certain extent, temperature could significantly change COVID-19 transmission, and there might be a best temperature for the viral transmission, which may partly explain why it first broke out in Wuhan, wrote the study authors. It is suggested that countries and regions with a lower temperature in the world adopt the strictest control measures to prevent future reversal. The CDC now estimates that over the next year, many people in the United States will be exposed to SARS-CoV-2. However, most won't be severely affected. It's fair to say that, as the trajectory of the outbreak continues, many people in the United States will at some point in time, either this year or next, be exposed to this virus. And there's a good chance many will become sick, Nancy Messonnier, director of the National Center for Immunization and Respiratory Diseases (NCIRD), said in a telebriefing trusted source with reporters on March 9. But again, based on what we know about this virus, we do not expect most people to develop serious illness, Messonnier added. Messonnier also warned that people who are at high risk, including people older than 60 or those with underlying health conditions, should start to prepare for the outbreak by stocking up on supplies in case they get sick or don't want to venture out in the community for groceries. Italy lockdowns to curb spread of virus. In Italy, where cases of COVID-19 have soared in recent weeks, the government is effectively locking down the country. The Prime Minister of Italy declared that virtually all commerce will be banned except for grocery stores and pharmacies. Recently, Dr. Tedros Ghebreyesus called on countries to make fighting the disease their highest priority. Local U.S. health departments warn they don't have enough tests, with increasing numbers of people reporting symptoms of COVID-19 across the country. Local health departments are warning they don't have enough testing kits. This month, a letter from Dr. Raul Perea Hens, the deputy mayor of Health and Human Services in New York, reported the city was given just 2 test kits. New York City must receive additional testing kits as soon as they are available from the CDC, Perea Hens wrote. With multiple positive cases, NYC needs maximum testing capacity to enable successful implementation of the public health strategies that best protect New Yorkers. The slow federal action on this matter has impeded our ability to beat back this epidemic. After initial test kits sent by the CDC were delayed in February, the federal government has come under increased pressure to provide test kits in order to gauge the extent of the outbreak in the United States. Vice President Mike Pence said that testing would be more widely available to Americans over the coming weeks, according to the New York Times. But he also said, "We don't have enough tests today to meet what we anticipate will be the demand going forward. You touch your face 16 times and our public health experts have advised people to stop touching their face to cut down on your risk of contracting the new coronavirus. But that's easier said than done." We talked to experts who told us how we can train ourselves to avoid touching our face constantly. More information can be found here. A bill passes. Health officials have been trying to stop the virus from spreading widely in the United States, but multiple cases of unknown origin have been detected across the country. The federal government recently passed an $8.3 billion aid bill to provide funds to help fight the outbreak. A new summary found that one way to slow the disease may be by simply getting a thorough travel history from patients. Healthcare workers prepare to evacuate residents from a nursing home in Washington. Getty Images. The WHO says the fatality rate is around 3% for COVID-19 in a press briefing. Officials from the WHO said the fatality rate for COVID-19 may be higher than previously realized. Ghebreyesus, the Director General of the WHO, said in a statement that SARS-CoV-2 doesn't appear to spread as efficiently as the flu. This virus is not SARS, it's not MERS, and it's not influenza. It is a unique virus with unique characteristics, he said. But it may be more deadly. Globally, about 3.4% of reported COVID-19 cases have died, he said. By comparison, seasonal flu generally kills far fewer than 1% of those infected. He pointed out one reason for those different fatality rates is that there are vaccines and antiviral medications to help treat flu symptoms. But nothing yet for COVID-19. Additionally, he said that according to evidence from China, only 1% of COVID-19 cases have no symptoms, and many people develop symptoms later on. Corona in coronavirus refers to the shape that can resemble a crown. Getty Images. How to stock your medicine cabinet for the coronavirus. As the outbreak continues to spread, there are ways you can prepare. Among them is simply stocking up your medicine cabinet with over-the-counter cold and flu medications. While they can't cure the virus, they can help relieve symptoms of mild cases. Research finds new ways the virus can spread. Researchers are studying how people with the virus shed it and what impact it's having on affected populations. One new study has found answers that many won't find comforting. Testing and confirmation of SARS-CoV-2 infection is currently carried out by oral swabs. But research published February 17 in Emerging Microbes and Infections finds evidence that there's an oral fecal transmission route. The scientists reported that virus's genetic material can be detected in both anal swabs and blood samples. Crucially, evidence of the new coronavirus was found in anal swabs and blood, even when it wasn't detected using oral swabs. According to the study, this was particularly true for those patients receiving supportive care for several days. Who's most at risk? Although medical staff, people with illnesses, and older adults are most at risk, more than 80% of COVID-19 cases have been mild, according to a new report from the Chinese CDC. Hubei province in China, where the infection is believed to have originated, is the hardest hit, according to the report. The province's death rate is almost 3%, compared with just under 0.5% in the rest of the country. A lack of paid sick leave in the U.S. could make the outbreak worse. One of the most effective ways to prevent the spread of illnesses like COVID-19 or the flu is simple: encourage employees to stay home when they're sick. But since the United States doesn't have a national paid sick leave policy, taking a sick day remains a financial sacrifice for 32 million workers who lack paid sick leave benefits. Without paid sick leave, workers are more likely to come into work sick, exposing their coworkers to an illness. This means if SARS-CoV-2 starts spreading widely in the United States, it could be difficult to stop. The disease gets a new name. The WHO announced February 11 in a tweet that the disease from this new coronavirus will now be called COVID-19. The virus itself is called SARS-CoV-2. Previously, it had been called 2019 nCoV, although many media outlets referred to the virus simply as coronavirus, even though that refers to a larger family of viruses. Will the outbreak stop this summer? Experts are still learning a lot about this new virus. But some have hoped that warmer weather will mean a drop in cases, similar to how flu season ends in the spring. But medical experts warn it's too soon to tell whether the SARS-CoV-2 outbreak will diminish this summer. Because it's a totally new virus, people lack immunity, so even in warm weather months it may still spread across the globe. How to treat the new coronavirus? Since SARS-CoV-2 is so new, there's currently no cure. But doctors have been able to use supportive care and other antivirals to try to help patients. Early studies show some evidence that certain medications, including those that treat HIV, may help fight the virus. What to do if you have symptoms of COVID-19? If you have COVID-19 or suspect you have the virus that causes COVID-19, you should seek medical care. You have several options for obtaining medical care, including being seen by your primary healthcare provider. The CDC recommends calling your provider first so that they can take the necessary steps to prepare for your visit and protect others from possible exposure to the virus that causes COVID-19. Some healthcare providers also offer virtual visits through your smartphone or laptop, so you may not need to leave your home for an initial assessment. If you don't have a primary healthcare provider, you can use this tool to find a local primary care office in your area. If you have a medical emergency, call 911. Notify the operator that you have COVID-19 or suspect exposure to the virus that causes it. If possible, put on a face mask before emergency medical services arrive. Disclosure: Healthline maintains a partnership with some of the providers linked above and may receive compensation for services provided. City workers have been disinfecting areas where the virus has spread in China. Getty Images: Will we get a vaccine soon? Multiple organizations are already working on a vaccine for the new coronavirus, but it's unlikely to be widely released within the year. That's because rigorous testing is needed to ensure that the vaccine is both safe and effective. Where did the virus come from? Experts are still investigating, but early research suggests the virus originated in bats and then was transmitted to humans via an intermediary animal. What's the intermediary animal? Potentially a snake or type of anteater called a pangolin. How to talk to kids about the outbreak? A global outbreak is frightening enough for adults. For kids, it can be overwhelming. We talked to experts about the best way for parents to talk to their kids about what's going on and how to reassure them. Parents should also check in with themselves and consider how their fears may be influencing their children. When a parent is anxious, their child is going to feel that anxiety and take it on, regardless of how well they think they mask or hide their anxiety, said Haley Natick, a licensed mental health professional and practicing psychotherapist.